Hey guys, happy Thanksgiving. I've been fighting with tackling this particular topic for a while because the legal repercussions of getting it wrong could potentially be very negative for me. And so I want to make sure that the way that I present this is just about the facts, as plain and simple as I can possibly make them. But there is kind of a time sensitive nature to this, as you know, we are all in this process now of buying our insurance plans. And I think that my personal experience here kind of argues why we need to be on a single payer system as soon as possible. And so my insurance and my coverage is through Kaiser Permanente, and my experience has been absolutely atrocious. And what I'm talking about specifically is PrEP, which is, if you are not aware, and if you are a gay man, you absolutely should be aware, is pre-exposure prophylaxis, which means that you put an antiviral drug into your body before you have sex or encounter blood or anything like that that can possibly transfer HIV into your system in order to prevent that HIV from being able to take hold. It is one of the most powerful steps that we have in order to prevent new HIV infections and one day beat HIV. Now, we can keep holding out for a cure, we can keep holding out for a vaccine or whatever, but we don't have those right now. What we have right now is PrEP. And PrEP has actually slowed the rate of new HIV infections to pretty much a crawl at this point. But it is still something that people should be doing because it protects you and it protects everybody that you have sex with or wrestle with, because you know sometimes we don't trim our nails as well as we can cut ourselves open, we can break noses, as has happened to me. Blood can be present with wrestling, and therefore it is really important that the best way that we can protect each other from HIV is to not get it in the first place, and therefore there is PrEP. Now, for the longest time, the two main prescriptions that you can get, and I believe there are generics now for pre-exposure prophylaxis, are Truvada and Descovy. And earlier this year, around I think January, but it wasn't becoming as mainstream until about March, is Apretude, which there have been some. I've actually been finding reports that Apretude was a little bit more available, just not as common until this year, for the last 2 to 3 years actually. And so don't quote me on that. You can look that part up. That's not part of what's legally important here. What is important is that according to the Affordable Care Act, and through a mandate from President Biden over the last couple of years, PrEP needs to be covered at 100% by all insurers within the US. Now, there was back in March a lawsuit in Texas, and I forgot to add that to my notes, that was an insurance company trying to get a religious exemption for covering PrEP, which, as I imagine that you're screaming at the screen right now, fuck that. So looking at what's happened with me in Kaiser, and this is partially probably because Apretude is such a new thing, and it's also rather expensive, but not as expensive as Kaiser would have you believe. So what's basically happened with or the way that you get into the Apretude program is you first have to rule out Descovy and Truvada as viable for you. And for me, I have a tendency to vomit every time I take Descovy or Truvada. I just throw them back up, and because I have anxiety, depression, ADHD that I'm all being medicated for at the same time, it's actually really problematic for me to be throwing up my medications. So we decided that Apretude was right for me because it bypasses the stomach. You don't take it every day. You actually, the way that it is administered is you get one injection in the first month, and then you get an injection in the second month, and then you get it in the fourth month, and 6 months, and every other month after that. And that's just kind of the loophole that insurance companies have for not having to pay for Apretude, is because it's so much more expensive, and there are cheaper options available. But when those are ruled out, it should be following under the same rules as Truvada and Descovy. And so when we're looking at the list price, so this is the price from the manufacturer's website. Actually, I got it through Viv, which is Viv Connect, which is, I believe, partnered through Apretude, their manufacturers and all that. So this is the list price that Apretude is supposed to be costing providers in order to get it. And I'm not sure if list is going to be the same as MSRP. So the Apretude list price is $3,812. The cost that what Kaiser charged me, and it's been different for each injection. And you might be asking me, well, if there's a problem with my insurance coverage covering Apretude, then why did I get multiple injections? Well, funny thing about billing and the way that our insurance works in the US, it can take 3 or 4 months before you get your first bill. And so by the time that I knew that Kaiser wasn't going to be covering it as they are legally obligated to, I had already had 3 injections. And when I had reported it to them, they kind of were like, oops, okay, let's look into that and see what's going on. And so I was encouraged to continue getting the injections. You can see where the problem is going from here, okay? So the Kaiser cost for Apretude per injection above MSRP, so this is $5,862, which is over $2,000 above the $3,812. In fact, yeah, that's about pretty close to just over $2,000. So the insurance covers it supposedly at 70% after deductible. My deductible was $2,500, $2,500. So the coverage for it is $2,822, which and they had like a little contractual discount, $1,731, and they also had an injection fee. So among the things that's in the Affordable Care Act, now I'm not going to really sweat this $52 for the injection fee, but the thing is that as part of the Affordable Care Act, when it comes to PrEP, all of your testing, all of the administrative things, everything that goes into PrEP is also supposed to be covered. Because you're obligated to get tested regularly, which, by the way, Kaiser actually fought me on doing my checkup tests as well, but we don't need to get into that too much. So really this injection fee probably should not have been charged either, according to the Affordable Care Act. So the final cost of it, before my deductible was met, was $2,959. Probably because I had other things that were going on at that point in time. So after deductible, each month, and again, this has not been consistent, so they've charged whatever they felt like charging each time, but my cost after insurance paid for it is still around $1,112 to $1,149. So Viv Connect, which is you've probably heard it before if you are on PrEP and you are getting manufacturer rebates or anything like that. So Apretude does have a Viv Connect program that maxes out at $7,000 a year. Well, when you're talking about a drug that is $41,000 a year, which is a number that came from based on the Kaiser cost, if I were to go with the list price, obviously it would be quite a bit lower. But, it still leaves a lot of room. And by the time I knew that I needed to sign up for Viv Connect, I was already 6 injections in, and they covered one of those injections, so $1,000 off of that. So my current total that I owe is over $6,000 after insurance for an insurance that is supposed to, under the Affordable Care Act, cover 100% of the costs for PrEP. And when I asked Kaiser about why it was not covered, they said, well, PrEP is not preventative care. which is probably the most aggravating thing. You probably are all screaming right now at your screens, because what is the whole purpose of PrEP? And they still to this day have not conceded that it is preventative care, at least not this year. They said next year it's going to be preventative care. Just wrap your mind around it. Like this is a drug that has one purpose and one purpose only in existence. It was created for the sole purpose of preventing new HIV treatments or transference infections. There's nothing in the world more preventative than that. It is the sole purpose of the drug. So I have to date provided links to the CDC site that says this is how insurance companies are supposed to cover this. I have provided links to HIV.gov. I have sent out links to news articles that say this is how this is supposed to be covered. I have done everything I can to try to find not just why they have to do it, but also how can they get away with not doing it. And frankly, other than the Texas case, I haven't found anything. I have not found any exemption that says right now you don't have to cover this like any other PrEP. And they don't. I've asked them multiple times, what is the exemption clause in the law? Can you cite it for me? Can you find that for me? Surely you have a legal team that can look this up and you can tell me why you're not covering this as you're legally obligated to. And they can't do that. So without actually even really looking at my notes, except for when it comes to numbers, I've covered absolutely everything that I kind of intended to with this. Now, I can go into many other reasons why you should not go with Kaiser Permanente for your health insurance, for your health care. So, in March, and I'm just going to state this flat out, that I tore my meniscus. And I went to go see my doctor. It took over a month to be able to get an appointment to see my primary care provider, despite the fact that I was injured. And I did not go to urgent care. I saw my primary care provider, who, by the way, is not a real doctor because they did not have a doctor for me to see. He is a physician's assistant. There is not a provider available, and that's, if you've been paying attention to the news lately, you've had nurses on strike, you've had administrative people on strike with Kaiser Permanente, who, because they are just so ridiculously short-staffed, because they don't pay people, they don't treat their people well, these people are constantly on strike. People in the mental health department, because they can't provide the care that their patients need. When I was with University of Washington, my time that I got to stay with my psychiatrist was 1 hour. With Kaiser Permanente, I'm lucky to get 20 minutes. And so, their providers don't believe in Kaiser Permanente, otherwise they won't be on strike all the time demanding for more help. They feel that they're being undermined by them. And so I went to see my doctor, or my physician's assistant, for my torn meniscus, which I did not know was a torn meniscus. And he was like, oh, there's definitely something wrong. Let's put you over in physical therapy. No x-ray, no MRI, nothing. We're just going to put you directly into physical therapy. Physical therapy scratched their heads a lot. And we did multiple visits playing kind of Marco Polo with what's going on, with no diagnostics whatsoever, in order to address what's going on in the knee. This is part of the reason why you guys have been getting great content from me, because I can't do it. I can't train right now. So it definitely affects you guys. And then when it comes to time that I'm like, okay, maybe what we need is more diagnostics, I ended up fighting with the nursing staff, I ended up fighting with my doctor, I ended up fighting with my physical therapist, and I said, I need somebody to go to bat for me here. And eventually my physical therapist caved and said, okay, well, maybe we'll get an x-ray. Well, an x-ray is going to tell you if a bone's broken. It's going to tell you if there's just arthritis developing. It's not going to tell you anything about soft tissue. Meniscus is soft tissue. And so when you've got an unstable knee that's just constantly swollen, they've acknowledged all these symptoms that are not just subjective but objective as well. We've done the x-ray, and now what we're seeing is that there is premature arthritis developing in the knee. And so, we started working with that, but we're like, well, that doesn't really get into what's going on here. So I saw my chiropractor, who's a longtime friend of mine, and he did some of the same tests and a couple more that they didn't bother doing. And lo and behold, he's sitting there going, I think that you've got like some major damage in this knee, and that's not going to show up unless you do an MRI. So I fought with them for about a month and a half, and I finally got the MRI. So if you're doing the math on this, this started in March. It is late August when I started to say, okay, I need to get the MRI. It was in mid-October by the time I was actually able to get in to do the MRI, and I had to drive out to Bellevue, which if you're from Washington, you know that that's from Tacoma, about an hour and a half drive. I left the house at 4 o'clock in the morning to get to my 5:30 appointment. 5:15, I think it was. And, I work in food service, so I just didn't go to bed that night. And so I finally got the MRI, and it showed a meniscus tear. It showed a significant joint effusion, which is a fancy word for swelling fluids in the knee. And I have not seen a provider since. They've kind of said, well, okay, now we know that's that, so let's go ahead and put in the referral for orthopedics. The referral took 2 weeks to process. And I still haven't seen my orthopedist. Actually, by the time it was processed and I was able to schedule the appointment, the next available appointment was over a month out in mid-December. So by the time I actually see my orthopedist, it's probably going to be, a month or 2 out before I can do a partial mastectomy, which is where they go through and they go over the scar tissue and they cut out bits of the scar tissue in order to allow the knee to move smoothly so you're not constantly inflaming the knee. This will actually help your knee to heal better, and it can lead to earlier not osteoporosis, arthritis down the road. So, this is kind of a long road ahead, and I'm not staying with Kaiser. It would be insane for me not to. The way that they handled me when I had kidney stones was just as abominable. And so anytime that something bad happens to me, I can't trust them to actually do what's right. In fact, when I had signs of when I had my kidney stones, I wanted to see my primary care provider because I had symptoms that was saying, hey, there's something wrong here. And this was actually after the kidney stones were removed. And I said, okay, there's something not right. And eventually, I think I ended up going into urgent care, and they found out that I had a staph infection. And if I had gone with the timeline that my primary care provider thought was appropriate, which would have been, again, a month and a half, I probably would have died. Is probably what would have happened. And I, of course, said that was unacceptable. And I ended up changing from my primary care provider to a physician's assistant, which is the dumbest fucking thing in the planet. And so it's just malpractice after malpractice, and an unbelievable amount of zero fucks given. So not to influence you too terribly much when it comes to you buying your next healthcare plan, but I would advise you to go with literally anybody else, because Kaiser Permanente, from my perspective, doesn't give a shit about their patients. They will price gouge you. They will not follow the law unless you absolutely force them to. And right now I am searching for legal representation to do that. So this is me putting on my platform, using my voice to say, and I have done interviews with news outlets and stuff like that. I have contacted the state insurance commission, and they are absolutely powerless to do anything about it. I've contacted my state representatives and kind of have gotten I think two back, but I haven't heard back from Jay Inslee. I haven't heard back from I think it was. I actually don't want to use names right now because I haven't kept as good of track, or I haven't written them down. So I don't want to like hurt somebody's reputation unduly. But what I've seen so far is zero fucks given from the local government. So my best move at this point is to advise as many people as I possibly can to say fuck Kaiser. Thank you for listening. You have a good night. Happy Thanksgiving. Bye.